It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome, everyone. I'm Sam Lesante, and yes, it is. I'm the host, but the new show that we're starting today is called Orthopedics on Call with Dr. Tony Falvello. And you remember last month, folks, we had Dr. Falvello on. We talked about a lot of interesting things. Today, with Orthopedics on Call with Dr. Falvello, it's going to be football injuries in kids and young adults. Now, being that I was a major football star, I never had any injuries, Tony. You understand that?
Yeah, of course. You were untouchable.
I was untouchable. You know, I was just fascinating. But I guess 'tis the season right now with football, okay? And there's a, describing the sport itself, it's a pretty violent sport, isn't it?
It is. It is. Out of all the sports that we have, it's probably one of the most violent. I mean, even though there's protection, there's pads, there's gear, there's still quite a bit of injuries associated with it. We see that a lot in the pros. You know, the average pro football career is only about 5 years, versus, baseball where you could play a long time. And, it takes its toll.
Well, it's interesting. I know you said, you're trained, they work out and they have the paddings, okay? But there's a lot of injuries that are associated with them, and kids have, particularly kids who have, as we have here, underdeveloped bodies. And get injured differently than adults, and how such.
That's true. I mean, the thing is here in Hazleton, the type of injuries we see are in kids. I'm sure there's a lot of viewers and people out there who have, kids or grandkids who play football, and unfortunately, injuries happen. But when you're developing, your skeleton's developing, and not just your skeleton, but your organs, your brain, the whole body it's different than treating an adult. And that changes as they go through puberty and go through development. As they get closer to approaching adults, the types of injuries that they sustain change and become different. And so what we're hoping to do today is, teach you a little bit about what type of injuries can happen, and, is there anything preventative that you can do to try and avoid those, or at least recognize them if you see them.
So one of the most common, I guess, is concussion.
Yeah.
Okay, so what do we do about preventing this?
That's a big one. And concussion, the biggest thing for prevention is obviously they've made advances in technology and helmets and things, and we think that stuff is helping, but is education. No helmet to helmet contact. We'll learn to tackle appropriately. These are the things that we see rule changes coming in, college football, pro football, to try and avoid that. But concussion in kids is a different animal than it is in the adults. In adults, we now see these lawsuits evolving against the NFL, for things in concussion-related long-term effects like Parkinson's disease that they think results from this, and of all the organs, all the parts of the body, the least understood is the brain, and I think that's why there's specifically so much fear there around that.
The thing that always worries me or concerns me, Tony, is when you're looking at, let's say there's an age group, okay, from let's say 6 years old to 10 years old. I don't know how they do the age groups. Now you could have a kid who is maybe 6 or 7 years old who is like a puny little kid. Mm-hmm. Then you could have a kid who is like 6 or 7 years old who's pretty well built.
Yeah, bruiser,
and he's a bruiser. I mean, he comes tackling this kid who doesn't have,
It is unfair, and we see that at different stages of development with sports. You got your 12, 13-year-olds that look like they're 17, and, and then the late bloomers too, and they're all kind of thrown into the pot together.
So what do you tell parents to do? I mean, to protect their kids, okay? I mean, so what are you telling them?
Obviously, it comes along with the coaches, specifically in teaching them how to hit appropriately and what not to do. There are other things coming into play now. I mean, there's legal effects. Pennsylvania this year, as of July 1st in 2012, adopted a head injury law, concussion law, that we've seen in other states, and it requires certain things be done for these particularly junior high and high school athletes, which is where we see most of the concussions. Certain things have to be done. Education for the coaches. If you have any signs of concussion, you're out of that game. No question. It's not like the old days. I hear my dad telling stories when he played football. You're fine. Get back in there. And,
is that what happened to your dad?
Yeah. He'll tell you. 4 concussions, I think it was. But yeah, it's not like that anymore. You show any signs of concussion, you're out of the game, and you have to be cleared by a physician who specializes in treating concussion or head injury in kids before you can go back. one of the things that's really scary about concussion in kids is this thing we call second impact syndrome. And this isn't intended to scare everybody out there, but it can happen. Second impact syndrome happens particularly in younger kids where they have a concussion, they get back in the game too soon, and they get hit again. And when that happens, we don't know why, but the brain swells dramatically, severe brain injury, and sometimes even death can happen. And it has happened. I think that's one of the big reasons that we're seeing these laws develop and these changes in the rules in the game of football to try and prevent that. Fortunately, second impact syndrome is less common in older athletes, but
Sure.
but it does happen.
So proper wear, make sure that they're properly the helmets and knowing your limitations. And I think you're absolutely correct when you say it's up to the coaches.
Yes.
Now,
yes.
if you have a coach who is, I know all coaches want to see their teams win,
Right.
and they want get those kids riled up. But in the same token, sometimes it could go a little too far, Tony. Don't you think?
It can. It can come from coaches, and parents are just as guilty. It's a shame. It's a shame that we see. There's this stigma with football. You got to be tough, and you can take it. Certain injuries. Yeah, that's true. You could tape it up. You can get back in the game. Head injuries is not one of those. And the truth of the matter is that there's a lot at risk, and we don't fully understand what the long-term effects are going to be. So better to play it safe, because I'll tell you what, that 8th grade championship football game is not as important as you think it is. To the parents and to the coach, it's everything, but it's really not.
Take heed, parents, take heed, and coaches, take heed. If you just tuned in, you're watching a new show. It's Orthopedics on Call with Dr. Tony Falvello, orthopedic surgeon, doing a fabulous job here in northeastern Pennsylvania. The number you can get him at is 570, of course. If you're watching us in Allentown, it's 570 area code 861-8220. And we're talking about football injuries in kids and young adults. One other area is the neck.
Right.
Okay, neck injuries, a lot of those.
Yes, that's very common in football. And fortunately, the really bad ones that you hear about, paralysis and those things are very uncommon. More common in the neck are those stingers or burners. People will complain they get that sharp pinching pain in their neck, and it may go down into their hand, and they get that kind of burning pain. And usually what that is what we call a brachial plexus injury. That's where the nerves exit the neck and they come down and into the arm, and they either get pinched at the neck or they get pinched, or pulled on sometimes in the shoulder. And in that case, you get that burner, that stinger, you got to come out for a little while. Sometimes the symptoms can take months to go away. Usually, though, those symptoms resolve pretty quickly. The bad thing about the necks, of course, is when we talk about spearing. That's when the paralysis can happen. When you use your helmet as a weapon, and you see somebody come in and they hit somebody either right in the numbers or right below their face mask with the helmet first. If your eyes are down towards the ground, your chance of having a severe injury is much higher. Which is, again, prevention is key here. They teach kids to tackle with their face up and their eyes looking at the numbers. And of course, never lead with your helmet. Never lead with your helmet. Now, we see these new shoulder pads compared to the old ones. You look at an old picture of football players, you got leather helmets and a little bit of pad in there. Things are different today. You've got the nice horse collars and things that will absorb some of the impact, but they're not, they certainly can account for proper form.
So therefore, it goes back to the coaches again, proper equipment, parents watching what's going on,
Exactly.
okay, and the aggressiveness. Shoulder injuries.
Yeah. Shoulder, we see a lot of different things in football. We see, particularly in quarterbacks and throwing injuries. On the inside of the shoulder, you could think of the shoulder as like a clock face, and around the outside of the clock is a rim of cartilage and called the labrum. At the very top of that, at 12 o'clock, the biceps tendon, which is one of the muscles that everybody works out all the time, attaches up there. And that injury, that motion of throwing a football, sometimes if you're getting hit while you throw, or if you throw, with improper form, you can tear that cartilage ring. We call that a labral tear, and sometimes, or a slap tear. Superior labrum anterior to posterior, meaning it tears from the 10 o'clock to about the 2 o'clock position. That's a common one. We see dislocations in the shoulder. If you get forced, you try and tackle improperly, the shoulder can pop out of the joint. It's a very unstable joint. Unfortunately, that happens. But overall, shoulder injuries are lessened by the shoulder pads and again, tackling properly and being careful. But sometimes, though, the only way to find out if something's wrong in the shoulder is with an MRI. And quite frequently, we have players who have these nagging shoulder injuries, and we need to get MRIs to kind of discern what's going on in there.
So what I'm seeing here, Tony, is that you have an aggressive team. Every coach is trying to train their people, the youngsters, to be the champs or the winners, and they're aggressive with what they do. Mm-hmm. Parents, as you said, sometimes are worse than the kids.
Yeah.
Okay, and they put the kids under so much pressure that these kids are doing everything just to impress their kids or their coach, and in the same time could cause serious injury to them. Okay,
Yeah.
so before we get into other injuries like the hip and the knee and the foot and ankle, etc. So what do you tell parents right now whose kids are involved with football, and young adults? What do you tell them?
Well, in the young kids, make sure they're learning the basics. Make sure they're learning, proper form for tackling. They're learning the game, and they're learning limitations of what they can and can't do. I'll tell you, in Pee Wee football, much more frequently than in young adults, we see fractures, okay? Because the bones are still developing, and there's these areas of the bones where your bones elongate from, at the shoulder, at your wrist, and down at your knee. They're called growth plates, and we have them all throughout our body. And, if you have kids, you might have had an injury where kid injured their growth plate. That's usually where the bone breaks, because that's a soft spot in the bone and it's a weak point for it to break. And those are the types of injuries that we see in these young kids. And in younger kids, particularly at the elbow and the wrist, they're very susceptible to fractures there. And when you watch these Pee Wee kids, the emphasis shouldn't be on aggression. It should be on sportsmanship. It should be on teaching them proper fundamentals.
Is there a higher rise in more of injuries now with kids?
There is definitely. Sports have become much more competitive. It's crazy how much they're pushed at such a young age. It really is.
I think it's sad. I think it's very sad. And you know what? I blame the parents. I really blame the parents, because they should know better.
Yeah. Okay,
and I'm not scolding here, but they should know better whether that child should be playing and pushing that child and putting that pressure on that kid.
Right.
And then they end up sometimes some very serious problems.
Right. That's true. That's true. I think it's important that kids learn to be athletes first and then choose a sport second.
You go.
You know what I mean?
There you go. Exactly.
I mean, that's really what it's all about.
Exactly. I think the discipline, as you know, you were involved in sports. Your dad certainly, the whole family was. Okay, the discipline in sports is a great thing. Mm-hmm. It's when it goes the other way.
Right. You take it too far. I mean, there's nothing like sports to teach you some of the best life lessons you need to learn. Being part of a team. Sometimes even being a leader. Humility. You learn that in sports. I mean, these are wonderful things for kids to learn, and I think every kid should participate in sports. But sometimes parents, coaches, even the players, the kids themselves, they don't know any better. They take it a little too far.
Well, they see the pros playing. They get hyped up. And,
that's right.
Sometimes you're in that hype, you don't even know you're getting banged. I remember talking to Bobby Tucker. When he was playing with the Giants.
Right.
And he, in the game, he said, but after the game, they were in the tubs or the jacuzzis,
yeah.
And their muscles are, he was in pain, from getting pounded that way, Other injuries such as the hip.
Yeah.
Okay, what are some of the hip injuries?
Well, in the hip, we see a couple of different things. Fortunately, the hip is a very stable joint, not like the shoulder. At the hip, the socket really comes over top of the ball, and that's pretty protective. One of the things we used to see a lot were what we called hip pointers, where somebody would take a shot on the outside of the hip, and if you've ever had one of those, boy, those can be really painful. Okay, that's just an area where you're subject to trauma there, because there's just skin and a thin layer of muscle and fibrous tissue and then bone. And if you were to look at those on MRI, you'll actually see changes in the bone that aren't quite a fracture, but you could see that an impact has happened there, and those can be a nagging injury. The hip, just like the shoulder and the knee, has cartilage in it, and if you turn the wrong way or twist the wrong way, you can injure that. That's called a labral tear. We see that more in older kids, and that can be somewhat debilitating. That can lead to early arthritis in the hip. And, that's a condition that we also see. But we also see, and kind of relates to hip, is, the old sprains and strains, hamstring sprain or strain. You see one of those, and, if a guy on your fantasy football team has a hamstring strain, take them out, because I'll tell you what, that takes forever to get better from, it's a nagging thing, and that's kind of more in the back of the thigh, but, it's, those things are very common in football, and they take a long time to get better.
So therefore, proper precaution as well,
yes.
proper, coating, and
a lot of this comes into the off season, right? All the training you do during the off season, stretching and flexibility is hugely important. Proper training, they say train like the game, practice like you play. And that's really important too. If you do those things in the off season, keeping your core strong and keeping flexible, those things will help prevent a lot of injuries that you see, not just in football, but in other sports.
The knee.
The knee, boy. The knee, we see a lot of injuries in the knee. Everybody comes
Why?
in, everybody, I think it's because, everybody thinks that, you play football, you're going to have bad knees later in life. That's sometimes true, but not always.
I would think the head, I would think the neck, I would think the shoulders, the knee,
The knee's pretty susceptible. The problem with the knee is that, football, you're twisting, you're turning, there's a lot of weight above the knee that the knee has to hold up, and it's under a significant amount of force. You'll see a lot of linemen, today they wear these hinged knee braces, big braces, sometimes even if they've never had a knee injury, just to try and prevent it. One of the common things we see, again, in younger kids we see fractures, in older kids we see torn ligaments and things like that. In the most common ligament everybody tears is the ACL. In football, that's no different. We know that if your foot's planted and somebody hits you from the outside of the knee, there's a couple of bad things that can happen. One of which is the ACL. Another part of it is usually a torn meniscus, which is a cartilage, shock-absorbing cartilage on the inside of the knee. You have an injury like that, you're out for a season. That has to be reconstructed, and the meniscus, if possible, has to be repaired. A lot of times it's not even possible to repair it. You just got to take it out. And but those types of injuries are really common. You can protect your knees by wearing braces while you play, but they're vulnerable. They're vulnerable to injury.
Well, you're getting me a lot of enthusiasm to play sports. Okay, how about foot and ankle?
Foot and ankle, in kids we see injuries around the growth plates. There's a lot of growth plates in the ankle, and we see broken bones again sooner than we see ligament injuries. Okay. Usually, most of the time, most of the broken bones can be treated with a cast, okay? Simple casting. Occasionally, surgery is necessary, but most of the time in kids, you can realign the bones while they're asleep. You push the bones back into place. It's not like the old days around TV where they say, bite this, and they set the fracture anymore. It's you come into the hospital, you go to sleep, they push it back into place, and you wake up with a cast. But the thing is that, as you get older, if you don't have a fracture, you can have a ligament tear in the ankle. Usually the outside of the ankle tears first, and in that case, if that doesn't heal properly, you get what we call chronic ankle instability, where the foot kind of has too much motion underneath the leg. And when that happens, there's usually, it's surgical, a surgical procedure is required. The thing about that is that you don't usually know that till 3 to 6 months, maybe even a year after the initial injury.
Folks, if you just tuned in, I'm talking to Dr. Tony Falvello, orthopedic surgeon. The name of the show, folks, Orthopedics on Call with Dr. Tony Falvello. You can contact the good doctor at 570-861-8220, located here in Hazleton at Coordinated Health, or for that matter, any Coordinated Health facility, you would be able to get in contact with Dr. Falvello. Staying with the theme today, football injuries in kids and young adults, we have the elbow.
Yeah, elbow injuries are more common in throwing athletes, more common in quarterbacks. In football, unfortunately, we do see elbow dislocations. If you fall with your hand outstretched like this, particularly if your body's in the air, the forces that go through the elbow are just a little too much for it to hold, and it can pop out of the joint. Usually elbow injuries, most of the time, are treated with just casting. Occasionally you do need surgery there. Elbow injuries, fortunately, are a little less common, but bracing again can help. But the elbow, it's usually susceptible in any instance where you have a bad fall.
Anything that they wear for that to prevent it?
Yeah, you will sometimes see people wearing elbow braces, but most of the time the elbow is pretty stable. The other thing that you sometimes see, particularly in quarterbacks, is rib protection.
Yeah.
When they're throwing, they'll need to kind of get their arm up out of the way, and you see them take that shot underneath the elbow like that. And rib protection is another good one, particularly for quarterbacks. That's important there.
I can never figure these. I kid with Ron Marchetti, and I say, football, throw the ball, get hit, fall down. Throw the ball, get hit, fall down. Basketball, get the ball, dribble the ball, put it in the basket. But yet, hey, how do you knock it? There's millions of people that are watching the game, et cetera. But I think pro, or when they're older and they're mature and their bodies are developed, I'm always worried and concerned about young people. Maybe high school kids to a degree, their condition, but those young kids, those are the kids that I always get nervous about.
Yeah, and that's actually there's some people who think that young kids shouldn't participate in football. Pee wee football's a mistake. I'm not sure I agree.
Well,
but
here's why I do agree.
Yeah.
Okay, and I agree because like I just said, my little grandson Mason, a beautiful kid. Okay, and he's about this high.
Right.
And I mean he could eat 4 times more than me, and he's a skinny little kid. Okay,
Right.
and he loves sports. But the point is, here he is. So if he gets excited about the game,
right,
and then he's playing, and the other kid doesn't know that bit. He's a bigger kid.
Yeah.
Boom. He can do a lot of serious damage to him. And that's what it's not the kid's fault. It's not the parents' fault. It just happens.
That's right. And it is uncommon. A lot of these, especially the severe injuries, are uncommon. But I am familiar with a young kid who was playing Pee Wee football and unfortunately had a bad fracture, lost use of his arm permanently.
There you go.
I mean, things happen. It's one of those things.
Now, I know you can't go into cocoon.
Yeah.
But sometimes you could prepare yourself. I mean, it is. It is a question. If you talk to a true sports fan, they're going to say you're nonsense. You develop. Well, okay, but I don't know. And how about the wrist? Now we get to the wrist too.
Yeah, the wrist is, we have classic teaching in medicine for the wrist is, fall on an outstretched hand, where we see everybody puts their hand out, usually their dominant hand to fall. So a couple of things can happen. The most common fracture we see in ERs, whether it's football or any other sport, is a wrist fracture. And as the bone breaks, the bone moves towards the back because you braced yourself like this. And, and wrist fractures, again, most of them in kids can be treated with casting. Occasionally, though, a surgery is necessary, a pin or something to hold it in place. Sometimes you can play with a wrist fracture. If you have a wrist fracture and it's on its way to healing, you may miss a few weeks, but you can get a cast and pad it up and sometimes play. That's one of the things, but we also see ligament injuries in the wrist in older kids, which that can be a bad thing. That can set you up for chronic wrist pain.
In general, when we're looking at the football season, and the football injuries in kids and young adults, I guess as an orthopedic surgeon, here again, for those people who are just tuning in, say, okay, what's the purpose of the show?
Right.
The purpose of the show is to make us aware of those things,
right.
correct?
Right.
So what do we do if our kid is involved in Pee Wee football or in the younger leagues? Once again, what should parents be looking to do to protect their kids?
What you got to understand is what's outside the realm of normal, okay? Anybody who's played football will tell you at the end of the game you're sore. You've got your bumps, your bruises, and even muscle aches and pains, but if you have a kid or an athlete who, is complaining of pain for more than a couple days, it doesn't go away, particularly if they have symptoms and they can't mask, that they can't hide. Because kids will want to get back in the game, but if you notice, this kid's persistently limping, or grabbing their wrist or their shoulder after they throw, something's wrong there. You got to get that kid checked out. You want to get it early because they're participating in a sport in which it can very easily get worse before it gets better.
All right, well, moving on to some other things. Now, you've been doing general orthopedic surgery, okay? You know, the carpal tunnel, you know, knees, hip replacements.
Yep.
What are all the other things you've been involved
Well, I do specialize in general orthopedics. You know, what we call the bread and butter of orthopedics is, you know, arthritis, treatments for arthritis, hip and knee replacement. We also do sports injuries, obviously. Rotator cuff, we see that. That's not just a sports injury. We see that very commonly, you know, as you know, you hit that age 50, 60 area there. Carpal tunnel is everywhere. People who use their hands repetitively get it, and quite frequently it does need surgery. So those things, along with orthopedic trauma, hip fractures, ankle fractures, those are the real bread and butter stuff that I do. The specialized stuff like scoliosis or, you know, complicated spine surgeries or other complicated joint replacement things, I'm happy to see most of those patients, but I usually send them to a tertiary care facility where they can get more appropriate care.
Yeah, and you were in last show. We were talking about the fact about the spine surgery. You seem to have a specialty in those areas. Now, in the coordinated health system network, are there any areas where you'd be able to perform spinal surgery?
There is, and we're looking into myself doing that. They do have a very good spine surgeon who specializes in more minimally invasive, you know, techniques. But we're evolving into that right now. I'm primarily treating it non-operatively. But yeah, I hope to be doing some spinal procedures in the future as well.
So as you're growing, and you know, they're telling me that you're really doing a fabulous job.
Thank you.
Spoke to some of your patients, and they couldn't say enough about you.
Thank you. Thank you. I try to keep it. I try to keep the personal feel, you know, and try and keep a good relationship with my patients. It's sometimes hard. We're definitely pressured in medicine to see as many patients in this short amount of time as we can, and that's modern medicine, and that's unfortunate. It wasn't always that way.
One of the things I hear about you all the time is that you're very thorough. And before you even go and operate on anybody, you're checking every vital sign. You're checking every X-ray. A person told me about you were ready to do a surgery on his mother, I think, and you saw a little spot, and you decided that no, you better move further, and found out that the person had cancer.
Yeah. I think it pays, you know, to do that, and you know, being, you know, somewhat fresh out of residency and out of training, you know, I look for those things that are sometimes uncommon. Sometimes you find them, sometimes you don't, you know. But
so far, you've been doing pretty well.
Thank you. Yeah, I think so. It's been very busy. The area's been very good to me, and yeah, I'm very fortunate to be here.
Now, there's only one problem you're going to have. You know, you're becoming quite a TV celebrity, I understand.
Right.
And so, I mean, it's either your dad or you or me.
Yeah.
And of course, you two lose.
Right.
Okay.
That's right. You're right. I understand that.
Yeah, I told your dad, Law Talk gets more familiar than, you know, the Sam Lesante or Orthopedics on Call.
Right.
You're hitting the road. Okay. Only kidding. Really, it's a pleasure dealing with you. I'm glad that a lot of people responded to you, and I'm sure this is the show, folks, is to bring information to you. And probably within the future, the good old doctor here will be taking the reins himself. I'm here just as a little co-host to help facilitate things. Dr. Tony Falvello, Orthopedics on Call with Dr. Tony Falvello is the name of the show. And it's 570-861-8220. Anything in closing you'd like to say there, Doctor?
No, just look for upcoming shows. We're going to talk about everything from hip and knee arthritis to fractures, osteoporosis, some important things that I think a lot of people want to see.
And with the latest in medicine today that we have available, I see it over and over again. Why are these people walking around with knee pain, hip pain, and all this when they really don't have to?
There's so much we could do. All you need is to get checked out.
Well, tell your lovely wife, Isabella, I said hello.
I will.
Okay?
Thank you.
You're watching Orthopedics on Call, folks, with Dr. Tony Falvello. If you have any questions or any concern, he's located here. Main office is a coordinated health system here in Hazleton and the Churchill Mall, 861-8220, and we'll see you next time.